80% of heart attack and stroke cases happen because of this. Each year, millions of people around the world lose their lives to an unexpected heart attack or stroke while sleeping, while taking a walk in the park, or even while laughing with their grandchildren. They show no warning signs, no overwhelming fatigue, no prolonged chest discomfort, just one fleeting moment, and everything collapses. We often assume that heart disease will come with clear alerts, a stabbing pain, a numb sensation, or severe shortness of breath. But the truth is, over 80% of heart attacks and strokes don't begin that way. They stem from the quiet things, the everyday habits you repeat without a second thought. Late-night meals, restless sleep, unrelenting stress, or seemingly harmless physical inactivity. The most frightening part? You still feel fine until the day you no longer have time to say goodbye. In this video, I'll reveal the 5 most common but silent causes that are silently threatening your heart every single day. And I'm almost certain that at least one of them is already present in your body right now. But which one is the deadliest culprit? The one that can kill your heart without ever causing pain? Visceral fat around the heart, the hidden killer. Many people believe that only overweight individuals are at risk of a heart attack. Many assume that cholesterol is the main culprit behind clogged arteries. But that's only the surface. The most dangerous threat hides deep within, and that is visceral fat around the heart, also known as epicardial fat. Unlike subcutaneous fat, visceral fat doesn't appear on the outside. It doesn't make you feel heavy or uncomfortable. It lies directly next to the heart muscle and coronary arteries, with no protective barrier in between. Once this fat becomes inflamed, oxidized, or toxic, it attacks the blood vessel walls directly, leading to atherosclerosis, endothelium damage, blood clot formation, and ultimately a sudden heart attack. Research shows that even a thin layer of fat surrounding the heart can double the risk of myocardial infarction even when other markers such as cholesterol, blood pressure, or weight appear normal. I once witnessed a man in his 60s, slim-built, not overweight, followed a decent diet. But when his MRI was taken, it revealed an abnormally thick layer of fat around his heart. That was the very reason he nearly died of a heart attack during an afternoon nap. He had no idea, and chances are, neither do you. Because visceral fat can't be seen with the naked eye, it doesn't cause pain, it doesn't make you feel tired, but it is a ticking time bomb inside your chest. If you're a man with a waist circumference over 102 centimeters or 40 inches, or a woman over 88 centimeters or 35 inches, your risk of having epicardial fat is very high, even if you feel perfectly fine. But that raises a critical question. Why would your body store fat around your heart, even if you don't eat a lot of fatty foods? High insulin and insulin resistance, the silent artery destroyer. The answer lies in a hormone that seems harmless: insulin. Every time you eat, especially refined carbs, sugar, or frequent meals, your body releases insulin to help process glucose. But when you eat too often or in the wrong way, insulin levels stay chronically elevated. Over time, your cells become insensitive to insulin, a condition called insulin resistance. And that's when the real damage begins. Chronically high insulin prevents your body from burning fat and instead promotes fat storage, especially around the liver and the heart. It triggers inflammation, damages the endothelium, and disrupts your body's natural healing mechanisms. The scariest part? You could be living with insulin resistance for 5 to 10 years without knowing it. There are no obvious warning signs, just subtle changes: increased sugar cravings, drowsiness after meals, and a growing waistline, even if you're dieting. Many people think that cutting sugar or avoiding soda is enough, but what they don't realize is this: frequent eating, 5 to 6 meals a day, even if it's healthy food, keeps insulin levels constantly elevated. And once insulin stays high for too long, your cardiovascular system loses its ability to recover. So ask yourself, are you eating too frequently without realizing it? And more importantly, how can you naturally lower your insulin levels effectively and without medication?
Industrial seed oils, the hidden danger behind the heart-healthy label. Have you ever heard someone say, vegetable oils are good for the heart? Many people believe that switching from animal fat to vegetable oil is a safe, heart-friendly choice. But if you're using soybean oil, canola oil, sunflower oil, or other common seed oils, you're actually consuming some of the most inflammatory fats ever created by humans. These industrial seed oils are extremely high in omega-6 fatty acids, which, while essential in small amounts, are highly unstable and prone to oxidation at high cooking temperatures. During manufacturing, these oils are often extracted under industrial heat, treated with chemical solvents, and refined using bleaching agents. When used daily, they don't just damage your cell membranes, they also accumulate in your body over months or even years. Silently, they trigger inflammation inside blood vessels, reduce insulin sensitivity, and accelerate the development of atherosclerosis. One of my patients was proud of eliminating sugar and refined carbs, maintaining a strict diet for 6 months, yet her health barely improved. Why? She was still using refined seed oils every single day. Only after switching to extra virgin olive oil and natural animal fats did her cardiovascular markers improve significantly within just a few weeks. So now let me ask you, what type of oil is currently in your kitchen? And could it be silently corroding your heart one meal at a time? Chronic stress, sleep deprivation, and modern habits. How you're pushing your heart to the edge without knowing it. Not everyone who suffers a heart attack has high cholesterol or obesity. In fact, many people with normal weight and a healthy diet still experience sudden strokes or heart attacks. One often overlooked yet extremely common reason is chronic stress and long-term sleep deprivation. The human body is designed to repair itself during sleep, especially in the deep, consistent phases of rest. But when you sleep less than 6 hours a night, or your sleep is fragmented, your biological rhythms are disrupted. This leads to persistently elevated levels of cortisol, also known as the stress hormone, which signals the liver to release more glucose into the bloodstream, driving up insulin levels in turn. And so begins a destructive cycle. Stress raises blood sugar, insulin increases to manage sugar, visceral fat accumulates, blood vessels become inflamed, heart damage occurs. Many people think that a few nights of staying up late or a few weeks of work pressure are harmless. But when this becomes your norm for months or even years, your heart begins to bear a burden far heavier than you realize. I once met a woman in her early 50s. She wasn't overweight, she had no chronic conditions, but she frequently stayed up late to work, often ate carbs at night, and carried a heavy emotional load. One morning, she woke up with a numb half face and slurred speech, classic signs of a mini-stroke, transient ischemic attack. There had been no clear warnings. It was simply the delayed consequence of years of living out of sync with her body's natural rhythms. So now ask yourself, how many nights have you sacrificed sleep for work? How many days have you let your mind spiral and worry without realizing that it's slowly wearing down your heart? Sedentary lifestyle and poor meal timing, the perfect recipe for a heart attack. You don't have to overeat to damage your heart. Many older adults eat modestly, sometimes just a few bites per meal. But the real issue lies in how often they eat. Frequent meals throughout the day, constant snacking, and late-night eating keep insulin levels elevated around the clock. Every time you eat, whether it's fruit, a glass of milk, or a few crackers, your body releases insulin to regulate blood sugar. And when you're eating 5 to 6 times a day, your insulin is always on, with no break to come back down. This constant stimulation doesn't just cause insulin resistance, it also leads to chronic inflammation and visceral fat accumulation. Now, pair this with a sedentary lifestyle, sitting for hours, watching TV, reading the news, or scrolling on your phone, and you've created the perfect internal environment for cardiovascular disease to thrive quietly. I once treated a 62-year-old man who followed a traditional 3 main meals, 2 snacks diet, avoided sugar strictly, and believed he was eating healthily. Yet he developed prediabetes, fatty liver, and high blood pressure. After switching to just 2 main meals per day, cutting out snacks, and walking briskly for 30 minutes every morning, his health markers improved dramatically in just 5 weeks. This wasn't the miracle, it was basic human physiology. When you give insulin time to drop and allow your cells to regain sensitivity, the body starts to heal. So now ask yourself, are you eating the right foods but at the wrong times? And are you sitting too much without realizing how it's silently damaging your heart? The end or a new beginning? The choice is yours. You've just learned about the 5 most common yet silent causes of heart attacks and strokes. They all have one thing in common. They develop slowly, quietly, and are easy to overlook. They don't cause sudden chest pain. They don't make you collapse instantly. But one day, when your heart can no longer carry the weight, it will show you the cost. The good news is, each of these causes begins with a habit, and habits can be changed. Your heart isn't asking you to be perfect. It's simply asking you to ease the burden, to give it room to recover. You don't need medication right away. You don't need a personal trainer. You just need to sleep a little earlier. Skip the late-night snacks. Start walking every day. Turn off your phone sooner. Eat more simply. And most importantly, start with one small action, done consistently. One tiny habit, repeated daily over time, can transform your entire cardiovascular health. So now, let me ask you, out of the 5 silent causes above, how many apply to you? And if you could change just one thing starting tomorrow, which one would you choose? Final message. One small action, one big chance to save a life. Some heart attacks strike without warning. Some strokes don't wait for you to call for help. And some of your loved ones, still laughing, talking, and living each day, may be silently walking on the edge of danger without even knowing it. Complacency kills quietly, but timely sharing can save a life. If you've watched this far, I believe you're not just thinking about your own health. You're probably thinking about your parents, your siblings, an old friend, or maybe that neighbor who's always complaining about poor sleep, constant fatigue, or a growing waistline. This video isn't just something to watch and forget. It's a reminder that disease can be prevented, change is possible, and you can save yourself, starting today. But more importantly, you have the power to give someone else a second chance. Share this message. Forward this video to someone you care about. Because who knows, that simple action might be the one thing that stops a heart attack before it happens. One message sent, one life saved. And if you'd like to keep walking this journey of living healthier, longer, and more meaningfully with me, subscribe to this channel. I'll be here every week to remind you you are not alone. Your heart can recover. Your body can grow strong again, and life is always worth living at any age.